Confused between Medicare and Medicare Advantage? You're certainly not alone. Welcome to the world of health insurance where understanding your options is half the battle. Today, we're setting the stage for a detailed comparison between Original Medicare and Medicare Advantage. Original Medicare, also known as Part A and Part B, is the traditional healthcare coverage provided by the federal government. It primarily covers hospital stays, skilled nursing care, and certain home healthcare services under Part A, while Part B covers doctor's visits, outpatient care, certain preventive services, and medical supplies. On the other hand, Medicare Advantage, often referred to as Part C, is an alternative to Original Medicare. These are plans offered by private insurance companies that contract with Medicare to provide you with all your Part A and Part B benefits, and often include additional benefits like vision, dental, and prescription drug coverage. Now that we have a basic understanding of the two plans, let's delve into the details. First things first, coverage options. Original Medicare, which is split into Part A and Part B, provides a broad level of coverage. Part A covers hospital stays, home health care, and hospice care, while Part B covers doctor visits, outpatient care, and preventive services. Now, let's pivot to Medicare Advantage plans. These go a step beyond Original Medicare, offering all the coverage of Parts A and B, but often adding on extra benefits. These can include coverage for prescription drugs, vision, hearing, and dental care. Some even cover wellness programs or transportation to doctor appointments. Imagine having a buffet of healthcare services at your fingertips. That's the kind of comprehensive package many Medicare Advantage plans offer. But remember, more isn't always better. It's about finding the right fit for your needs. Coverage options play a crucial role in choosing a plan, but they aren't the only factor to consider. Next up, let's talk about money. Now, when comparing the costs of Medicare and Medicare Advantage, there are a few factors to consider. First, there are premiums, which are the amounts you pay monthly or yearly for your plan. Medicare Advantage plans often have lower premiums than Original Medicare, but this can vary widely. Then there's the deductible, the amount you must pay out of pocket before your plan starts to pay. In many cases, Medicare Advantage plans have lower deductibles than Original Medicare. Lastly, co-payments, the fixed amount you pay for each visit or service. These can also vary, but it's not uncommon for Medicare Advantage plans to have lower co-payments than Original Medicare. However, it's crucial to remember that Medicare Advantage plans often have different cost structures than Original Medicare. So, while you might pay less in one area, you might pay more in another. It's all about finding the right balance for your specific needs and budget. Costs are definitely a major factor, but they aren't the only thing to keep in mind. Now let's consider network considerations. One thing about Medicare Advantage plans that's quite unique is that they often have networks of healthcare providers. This means that the doctors, specialists, and hospitals that you can visit under a plan are typically predetermined. If you have a favorite doctor or a trusted hospital, you might want to ensure they are included in the network of the Medicare Advantage plan you're considering. That's why it's crucial to do a bit of research before making your choice. It's about knowing where you can get your healthcare services, and also about ensuring that you're comfortable with those options. Remember, healthcare is a personal thing, and it's so important that you feel good about the places and people who will be providing your care. While networks are important, they aren't the only thing to consider. What about additional benefits and flexibility? Well, let's dive right into it. Medicare Advantage plans often come with a cherry on top. Extra benefits that Original Medicare doesn't cover. Think vision, dental, and prescription drug coverage. These can be significant perks if they align with your healthcare needs. On the other hand, Original Medicare swings the pendulum towards flexibility. You get more freedom to choose your healthcare providers, which can be a boon if you have preferred doctors or hospitals. Medicare Advantage plans, while they might have some restrictions, often wrap up a more comprehensive package of benefits. It's like getting a bundled deal, which can be very convenient and cost-effective. Remember, the goal here is to strike the right balance for you. It's about figuring out what you value most in your healthcare coverage and finding a plan that mirrors those priorities. The right balance of benefits and flexibility can make a big difference in your healthcare experience. Last but not least, let's talk about prescription drug coverage. The realm of Medicare plans can seem like a maze, but when it comes to prescription drug coverage, there are two main paths you can take. The first route is through Original Medicare with a standalone Part D plan. Part D is specifically designed to provide prescription drug coverage, and it's an add-on to your Original Medicare plan. It's like a supplement, filling in the gaps where Original Medicare might not cover your medication needs. The second path leads to a Medicare Advantage plan that includes drug coverage. This is an all-in-one alternative to original Medicare. With this plan, your hospital, medical, and prescription drug coverage are all bundled together. Both routes have their own benefits and potential drawbacks. It's crucial to consider your personal medication needs, your budget, and the convenience factor when choosing between the two. Prescription drug coverage is a crucial factor that can greatly influence your decision. Let's recap what we've learned. We've delved into the world of Medicare and Medicare Advantage, exploring the various coverage options available. We've compared the costs associated with each, looking at premiums, deductibles, and co-payments, and how Medicare Advantage often has a different cost structure to original Medicare. We've also considered the importance of network considerations, acknowledging that Medicare Advantage plans often come with a network of healthcare providers, which may or may not include your preferred doctors and hospitals. We've touched on the additional benefits offered by Medicare Advantage plans, such as vision, dental, and prescription drug coverage, and considered the flexibility of original Medicare in terms of provider choice. Lastly, we've compared the prescription drug coverage options between original Medicare with a standalone Part D plan and a Medicare Advantage plan that includes drug coverage. Remember, choosing the right healthcare coverage depends on your individual needs, health status, budget, and personal preferences. It's all about making an informed decision. This has been a Mystichill production, your one-stop YouTube channel for all things health insurance. We're here to help you make sense of the complex world of Medicare and Medicare Advantage. Before we wrap up this video, we want to remind you of how you can stay connected with us. On your screen, you'll now see a like and subscribe button. Clicking the like button lets us know that you appreciate our content, and hitting subscribe ensures you'll never miss an update from us. It's your way of showing support, and it helps us continue to provide useful, clear, and concise content on health insurance. So go ahead, click those buttons, and become a part of our growing Mystichill community. Thank you for your support and see you in our next video.